Good morning, everyone. Welcome to MTBC's first Medical Advisory Committee webinar. And to begin this webinar, I would like to introduce myself. My name is Praveen Kanda. In my current role within MTBC, my capacity is the VP of Intellectual Property and IT. So I work as the member that organizes MTBC's IC solutions. I'm joined with Dr. Ardash Gupta.
Hi, Praveen. Thanks for having me here today. I'm Dr. Gupta. I have a practice in Southern New Jersey. I am a family doctor, and I've been using EHR since 2001. I've used multiple EHR. I've been with MTBC since 2003 and playing different roles, and at present we're working as a consultant on multiple topics that deals with health, IT, and practice solutions.
Currently, Dr. Gupta acts in a role where he can provide us insight into a few of the changes regarding the healthcare market. And I think the one that we will talk today about is Meaningful Use Stage 2. As many providers know, Meaningful Use Stage 2 begins on January 2014. And this webinar will cover a few of the things that I believe that providers need to know about Meaningful Use Stage 2. So, Dr. Gupta, what do you think is the most crucial or vital element in Meaningful Use Stage 2 that the providers need to implement?
Probably Meaningful Stage 2, I think is going to bring in, and it's coming into a time where the provider is going to face a big challenge, and I think I call that 2014 regulatory storm. Because not only they have to meet Meaningful Stage 2, but they also have to meet the requirement for ICD-10 in October 2014. So that brings in a lot of things, a lot of changes in workflow for providers to meet both the requirements. And one thing to focus on, just Meaningful Stage 2. Meaningful Stage 2 focuses a lot more on patient engagement and electronic data transfer. Talked about one thing is the patient portal, which is where the patients are engaging with the doctor and the practice. And Meaningful Stage 2 requires that at least 50% of the patients seen through the reporting period were given timely online access, that is within 4 business days of a visit, so that they can get the health information. And in addition, more than 5% of patients seen in that period must actually view, download, or transmit to a third party their health information. Now, it seems like 5% is a very small number, but 5% could be a big thing for a practice who doesn't really understand Meaningful Use 2, because the two things are important. First of all, in order to interact with your patients, you need to have a patient portal where patients can communicate with the doctor. Second thing is to be able for patient to use it. That means it's going to require a big workflow change from the practices, so they are communicating with their staff and the patients timely manner every day, so that the patients knows about the patient portal, and somehow persuading patient, telling them the usefulness of patient portal so they start using it. That is the biggest challenge, how to make them use the patient portal. And I'm sure MTBC have an IPHR, which is a patient portal on a smartphone, and probably you can talk to them about it. It does a lot more good things.
Exactly. So one of the mindset MTBC has when viewing this patient portal is we realize that as a EHR vendor, we give the provider information at his fingertips. So when MTBC looks at Meaningful Use Stage 2 requirements, which requires more patient communication, we see that having to be integrated with the EHR. As of right now, MTBC offers a mobile PHR, which can be accessed either via your mobile phone, either an Android or an iPhone, or you can use the website at phr.mtbc.com to access your PHR. Now, both these ways let you view data for your PHR. As Dr. mentioned, at least 50% of your patient must have access to this PHR. A way to simplify this is all that MTBC requires to send a patient a link to access their EHR is we require their email address. As soon as a provider puts the email address in the EHR and MTBC, we shoot an email asking the patient to now create credentials to log into their account. In addition, we also let the patient, once they log into the PHR, they can schedule their appointments if the provider allows them. They can view their past appointments, view any future appointments. request medication refills. They can also see their claims because we are also the provider's billing company and see how much payments are owed on those medical claims. In addition, we also let them look at their healthcare information such as medications and allergies. Now, Dr. Gupta, what's the most important thing about the PHR? Is it the security element or is it the access element?
I think I was going to just say that right away. The key thing is to focus on patient portal. It allows you to communicate through your provider for multiple issues, whether it's just sending message back, requesting appointment, getting the lab report to the patient. But the key thing to focus on patient portal, that it is secure. It is not the same as sending an email. When you send an email to your patients and send something on email, it's not secure. And meaningful use stage 2 doesn't want that. They actually want that to be secure. That is the key thing to focus on. It has to be secure because you're sending out patient data on the cloud by an email and anybody can capture that. And one thing to focus on to make it secure is make sure it is encrypted. That brings it to the second point of clinical data exchange. Meaningful stage 2 requires that each provider must provide summary of care record to more than 50% of transition of care and referral. And in 10% of those transitions, summary must be transmitted electronically using a certified EHR. And not only that, meaningful stage 2 has a stipulation that it has to be secure and encrypted. Encrypted means when the data leaves your computer, it is going through encrypted form that nobody can be able to read that data, and it goes to the destination where it is decrypted so the provider or the client or the user can see it. That way, nobody can access the data because it's flying encrypted on the cloud, and that's technology you should have in place, and you have to make sure that your EHR has that technology, or if you don't have EHR, maybe you have to join an health information exchange, which is not that widely available everywhere. But if you don't have that, then you have to make sure that your EHR has that technology. And I know for sure MTBC has that in place. Probably you can talk about that.
So MTBC views the security requirements in the PHR in a very highly standard. One of our requirements when creating a PHR account is we let the patient actually verify their identity. The way we verify their identity is we actually request the patient to provide their date of birth, the last 4 digits of their social, possible contact number, or their patient account number. All of this information is available through the EHR. So the EHR user is the only one that's allowed to create that access for the patient. Even once the patient logs in, a verification message is sent to the provider's EHR where the provider has to verify that patient. Now, once the provider verifies the patient will have access to his portal. This heightened security method allows us to monitor which patient have access to their account. In addition, it also makes sure that an unauthorized access does not occur within the patient. We also follow the industrial standards of HL7 for data. This is a more secure method of maintaining the data available in the EHR. Likewise, it's also going to be the standard most likely where you transfer data onto the PHR. In addition, we use SSL encryption technology to make sure the password and username are secure and hence can't be decoded by any outside person. We also hope that our system is more privatized to the patient and the provider, so you still maintain that doctor-patient confidentiality. So, Dr. Gupta, we believe that the Meaningful Use Stage 2 will significantly affect the provider's workflow?
I think it's going to make a big impact on the provider's workflow, but I think it's for the good. The key thing is, since you have so much patient engagement and the electronic data transfer, the providers need to focus on how to tell your patients about the patient portal, how to make them utilize the patient portal, and that's going to involve a change in the workflow where each provider and the staff and the patients are communicating with each other about the patient portal. The provider and the staff have to make sure that after every visit, they are telling the patient to use the patient portal, utilize the patient portal, show them the benefit of using patient portal, because only then patient will use it. And when patients start using it, which we need at least 5% of patients, that's when we start seeing the biggest success. Now, it's going to be changed in the beginning, but I can tell you, in long run, it is going to be so much helpful because you will spend much less time in picking up a phone and telling them, calling them for things that are very simple. Just telling them normal lab results. If you have patient portal, you can send a quick message, you're done, patient will get the message, labs are normal. You can even see the labs. That will save you so much time in going forward So that change in workflow right now would be a change, but it's going to be very beneficial going forward.
Yes, and MTBC already has that feature within our PHR. Currently, we let providers actually send in documents from our document management system right onto the patient portal. In addition to sending the documents, we also let the provider attach a comment about the document. So when you send a lab result, I'm pretty sure providers out there will not want to send a lab result saying one number is abnormal. This will cause the patient worry and concern. Now the provider can actually put a comment saying, this lab is abnormal, but there's nothing to worry about. We can stabilize this. So it'll calm the patient down. They'll look at their lab results. They'll have that in their fingertips. If they go on the website, they can actually print out this lab result and even hand it to another provider if need be. So this idea of patient-provider using an electronic means of communication will improve in the future, and I expect that providers will really take advantage of it.
I think the one thing I would mention, I think with that, if you do send a lab and the patient does have a question, patient can use the PHR app and send a message to the doctor directly without waiting for the phone call back from doctor, and that will give doctor instant message, oh, this patient asked me this question, and he will reply back instantly. Exactly. So that two-way communication will in fact make a very good doctor-patient relationship and will be very efficient.
Exactly. And do you believe that's the goal of Meaningful Use Stage 2, Dr. Gupta?
I think the way they have designed all the Meaningful Use Stage 1, Stage 2, and Stage 3, which is going to be happening very soon, the goal of that is get the doctor to start using the electronic health record. Second, Stage 2 focuses on involving the patient engagement, and transferring the patient data from one EMR to other, which is the goal of Meaningful Stage 2. And I guess Stage 3, which we don't know what's going to happen, but it's going to be same thing plus more, so that every system is talking to each other, so we'll see what happens there. Right. But the main thing to focus on, I think I want to mention that since in 2014, we're going to have so many things happening, each provider, you really need to focus on his timeline, when they should implement what, so that they can meet not only the Meaningful Use 2 requirement, but also ICD-10 requirements in October 2014. And I think we're going to have some few more webinars.
And yeah, that's a perfect way to transition into our next webinar. So our next webinar will most likely be on this timeline, and we can talk about MTBC solutions to this timeline and how we plan on implementing our requirements to be certified under Meaningful Use Stage 2, as well as what our change will be within our system regarding ICD-10 as well. So that way we can have the providers, our providers, see what MTBC solutions are. Again, I'd like to thank Dr. Gupta for his time, and I'd also like to thank all of our listeners to this webinar. Thank you, and we appreciate your time. In order to contact me, you can contact me at pconda@mtbc.com, and you can also contact Dr. Gupta at askgupta@mtbc.com. Or you can contact the MAC board in general if you would like to be an applicant at macboard@mtbc.com. Have a great day.
Bye.